Instagram followers, I've got the gorgeous Michael Shikashio has come back to see us. We are very, very lucky. He was here with us, would it be beginning of this year? I think it was beginning.
I think so. Yeah,
January
something like that. Yeah.
Yeah, and I don't know where the time has gone, because I can remember thinking, oh yeah, August is miles away, and suddenly we're back at August. So before we start, because it's going to be a really good topic, it's quite a beefy topic, I just want to say thank you to our sponsors tonight. So thank you, Pitpat. This is an activity monitor. It's not a GPS device, it's an activity monitor. So it isn't going to tell you where your dog is and where they've been, but it's going to tell you what they're doing. And this is really, really useful when we're trying to objectively monitor our dogs. So if we've, say, started a dog on a pain relief program, and we start seeing that our dog is doing more walking, is more energetic, is playing more, is potentially sleeping less, this could be a very good positive indicator, because objective monitoring is very, very difficult. You have two lines. You have your questionnaires, or you can start using these devices. And the one that we like is Pitpat. It's very affordable, so it's £39, clips onto their collar. It's non-invasive. You just upload to your phone and it can give you some really great detail to use. So I really, really, really strongly suggest, if you're struggling with your objective monitoring, this is a good addition, and I'll give you a link to where you can purchase later. Let's get rid of Pitpat. Back to Michael. Please tell us a bit about yourself. Super, super excited.
Yeah, thanks for having me back again. This is exciting. This is a topic that's near and dear to my heart, talking about what impacts behavior, especially aggressive behavior in dogs. And so that's what I focus on, is aggressive behavior in dogs. I work exclusively with aggression cases, and I've kind of moved towards teaching other trainers how to take on aggression cases and help the dogs, live better lives and move away from having to use aggression.
Yeah. So how did this start? How did you go into aggression? So you started off as a trainer with and you found an affinity for it. What happened?
Yeah, kind of just like yourself, in terms of you start kind of getting a general idea of, veterinary care. And then in my world is the training world. And then you start to find specialties, something you want to actually specialize in. And so that's, I kind of took a liking to aggression, because I found out many, many dogs were being surrendered or even euthanized for aggression issues. And, there was some information out there, but I feel like, of course, there's a lot more to learn about helping dogs with aggression and helping pet owners around the world help navigate how to work with aggression. So I found that I could be the most beneficial in that aspect versus trying to concentrate on everything. It's very difficult to be good at everything, as you know. So it's better to specialize. And when you specialize, you start to see little things that you might not have if you were taking on everything, right?
I'm glad you said that, because you're probably the same as me, in that when I started with the fixation on arthritis, I thought, finally, there'll be one thing that I'll be good at. And the deeper you go into it, the more you realize you don't know anything.
Exactly.
The more you learn, the more there is to learn. And you're like, crikey, just one disease. But so start off by telling who inspires you. Who on your learning journey and into your career, who has really made a difference to you?
Do we have a couple hours? I've got a lot of people that have inspired me over the years. Really, the dogs that I work with were my number one inspiration. I used to foster a lot of dogs, and a lot of dogs they start sending you more difficult dogs when they know you're a foster that's had experience. So, or if you're a trainer that's also a foster, they really start to send you difficult dogs. But living with and helping dogs with behavior issues, not only just aggression issues, is by far the single most significant influence any trainer can have, because you are living with them. But of course, there's plenty of trainers and mentors that I've had over the years: Jean Donaldson, Patricia McConnell, Ken Ramirez, Susan Friedman. The list goes on and on and on as far as my folks I consider mentors, and also friends and colleagues that have helped me learn. And I'm glad I'm able to give back and help other trainers learn now. And so it's a ripple effect, as they say.
It's a ripple effect, because you do an academy, don't you? So we must put the links in for that.
Sure. I have the Aggression in Dogs Master Course, and that's where I teach most of my trainers now. But I also travel around the world, and I'm fortunate to be able to do that. And again, meet and work with other trainers from all over the world in different countries. It's been wonderful.
And you touched upon you foster. So how many dogs would you ever have at one point? Because I feel quite guilty. I only have one who is the love of my life.
Yeah.
And I sometimes wonder what it would be like to have multiple dogs and not being able to give your heart to one.
At the peak of my fostering career, I had 8 dogs in my home at one time. But it's been anywhere from 1 to 8, and then in between. It depends on what's going on in the world and how many dogs they need to have a foster home for. So it gets tricky though when you have dogs not getting along, or you have to manage the dogs, and you have that number of dogs. So it can get
every room kind of gated.
Interesting. It looks like Alcatraz, or like a prison in the sense of all the gates and safeties and everything like that. But I was fortunate in my previous home. I did a lot of fostering in, and it was set up in a way that it was, the dogs had a nice big yard, all this way to be safely separated, but without losing any kind of quality of life. So it was a good setup.
Yeah, because you want I imagine many of these dogs that you foster have come from a home environment, so you don't want to change the environment. You want to try and establish we're still a home, but we've got to look after ourselves.
Exactly. Yes. Yeah. It's always good to keep them in a home environment and not in a sheltering or kennel environment in most cases. So, yeah.
And do you have a partner who's also very on board with this aggression?
Well, my girlfriend is a veterinarian as well, and she's like you, not me. I'm not a veterinarian, but she specializes in separation anxiety in dogs, and so that's her specialty. So we actually it works well together because we both work from home right now, and taking on clients and trainers from around the world. And her focus is on separation anxiety. So. And she strictly focuses on that. So it actually works out well. Yeah.
Wow. And just because I'm interested, how is the whole telehealth approach to these cases? Because with COVID, I think a lot of owners have felt very lonely and very stranded. Do you feel that you've managed to offer the same service, but without being there?
Can you imagine just 5 years ago, if somebody says, can you treat my dog through a Zoom, or can you train my dog through a Zoom call? And people are like, what's Zoom? Or like any kind of video teleconferencing. People would have laughed about it 5 years ago, but now it's such a change. People are so used to using Zoom and conferencing this way and learning things. And I found that it actually can be even more beneficial in aggression cases, as well as separation anxiety cases, because when you're there as the trainer in person, you're really impacting what the behavior is truly going to look like, especially for separation anxiety. It's better if the trainer's not there. Aggression cases, though, sometimes you're in the home and the dog's just like, who's this strange person in my home? And then it actually can impact the behavior. So ideally, I consider all first sessions should be done remotely, because you're going to get much more information without the distractions and without upsetting the dog if they have issues with strangers. Subsequent sessions can be in person.
Then, aren't you?
You can do so much, right? And you're not impacting the dog's behavior. You're getting more, you get, I think, better conversation also, because the client's really got to concentrate on you as when you're on a teleconference. So there's less distraction. So it actually works out quite well. And with the beauty of technology these days is that you can teach a lot through videos and watching their videos and slow motion and screenshots, and there's so many benefits to technology now. So I actually find it more beneficial now to do remote consults than previously.
Yeah. Definitely. The only limitation for someone like me is the palpation.
Exactly.
We really want to be handling, because there's some things that you just won't pick up otherwise. But I totally agree that if the owner is looking at the screen, you've got their attention. In a consult room, when there's a child, a mobile phone, there's noise behind the door, they're holding onto the dog, you're like, I think you're taking in 10% of what I said.
Yes, yeah. Those distractions can really, put up a layer of like a buffer between what you want for information as the consultant or the veterinary specialist, right? You've got to get certain information that's going to be most helpful. Yeah. But there are solutions to that too. Like, for instance, if you had a veterinarian in that client's location, they could do the testing or the diagnostics, but you're the specialist, so then they can feed you that information, so you can make those specialist calls. So that's what I do a lot too. I have trainers that go sometimes work with the clients in their area and to teach some of the basic skills or some of the things, but I form the actual behavior plan for them. And so it works out really well as a team.
And your favorite people, don't you? Deborah's
Yes,
worker.
yes, yes. I could walk to her house from here. It's wonderful.
Yeah, finally got to interview her, and she is amazing.
Yes, she is. She is.
Cool. So people, if you have been thinking this is really something close to home, and I've been avoiding seeking help because of the COVID situation, because you're in fear that you're not going to get a good service by not seeing the trainer, the behaviourist, etc., in the flesh, don't be. Because Michael Shikashio has just told you that he feels that actually he's getting more out of his consultations in this video world that we now live in. Okay, so we're going to crack on with the topic, and we're going to keep it super simple because I am not a behaviourist. I am not a trainer. I have a dog that came pre-programmed and is perfect as far as I'm concerned. So I have never had to go into this world. I'm probably going to use the wrong terminology, so don't shoot me, but help me. And I think that is something that really concerns a lot of people. I know it concerns veterinary professionals. The terminology is changing quite quickly in the behaviour and the training world, and we fluff it. We say the wrong word, and we label, and we don't mean to label. So when I hiccup, correct me. If there's a better term, let us know, because you become inhibited about talking for fear of saying something wrong. But I have no shame, so it's okay. So let's start off really, really simple. What is aggression? And
Yes.
give me a scale, because it's not just one kind of behavior, is it?
Exactly. So, aggression is, the better way to define it is to call it aggressive behavior. So aggression is kind of a personality trait or kind of a blanket label for a number of potential behaviors. But when we say aggressive behavior, now we're talking about actual observable behaviors. So it doesn't matter what we think of the dog in terms of personality or anything like that. We can all agree that when we see a dog barking or lunging or growling or snarling or snapping or biting, we can say that dog was growling, lunging, snarling, snapping, or biting. We don't have to even call it aggressive at that point, but we can describe the behaviors. So aggressive behaviors typically fall into those categories of barking, snarling, snapping, lunging, biting in most cases. But then even then, it's not always an aggressive intent. For instance, a dog could be biting onto a tug toy. That's a biting behavior, but it's not an aggressive intent, right? Or biting onto a bone or something like that. And so there's different underlying motivations for those behaviors. But most of the time, if we just take a step back and just ask what the dog is doing, and that most people will be able to agree upon is if they're just describing what they're seeing rather than what they think the dog is thinking. And that's an important distinction there, because we don't know what the dog is thinking. We can make educated guesses based on the context and the dog's body language, but it's best. First step is to always look at what the dog is doing first, and then look at the environment. That's what's going to help us. So that's the simplest way to look at aggressive behavior. The intent is to increase distance from a stimulus. That's all it is.
Love that. Okay, so I think a really good take home for anybody that is thinking, right, I need to start approaching somebody because we've got a bit of a problem at home, and we're going to talk about the behaviors and describe them rather than trying to label them. So when you're approaching a trainer or a behaviorist, say what you see rather than saying your assumption of what's driving it. So first off, this is like a game show. Say what you see, say what you see. And then we can also don't kind of label the dog, just say the behavior that is unwanted, it has an aggressive nature to it because you feel that the dog is trying to get distance. There's something happening that the dog's saying, get away from me, go back. Yes. Okay, so that's really helpful because I feel really bad where it slips out, you say, oh, that dog's aggressive, because I don't want to label the dog. As you say, that could have been a moment in time, and that dog's now been stamped forever as having that tendency. Okay, so that's good. Anything you want to add to help people out?
Yeah, it's just, again, it's going to be much more helpful if somebody comes to me and says, my dog barked and lunged at my friend that stepped onto my property. That's going to be much more helpful than, I think my dog's being dominant, I'm not being alpha enough, that dog's being territorial, my dog's being stubborn. Just those descriptions of those labels will not help me help the dog. What's going to help me is hearing that the dog barked and lunged at the friend coming onto the property. Now I can work with the dog because I have a description of the behavior and the context, And then I can help the client understand why the dog is doing that. So it's try to, again, so much easier if you just look at what the dog is doing rather than trying to determine what's going on up there.
Like it. So give us just some examples. You've done the barking and the lunging. Like, look back in your long history of cases, because I know as a vet, if somebody comes in and says, my dog's got a wound, some owners, it'll be a tiny little pinprick, and other wounds, it'll be like half the dog's missing. And you're like, okay, there's a big scale here. So just give us some examples from what you were like, wow, I didn't really put that in that category, but if it's a problem to you, I get it, all the way to.
Dog bites are very much like that. So when a dog bites somebody, you'll have different emotional responses from the humans about what's going on, because it's often very offensive to us as humans for a dog to bite or show any aggression. Growling even can be very offensive to us, especially if it's our dog and we're the one providing them food and a warm, comfy spot and all their toys and taking them to daycare and all these other fun things. The response from us is sometimes, how dare you growl at me? I'm the one that gives you everything. And so it can be that emotional sort of response immediately. And so that impacts the perception on the behavior, whether it's a bite or a growl. Bites especially, though, I've seen low-level bites where, a child might be bitten on the hand, for instance, and there's barely a scrape or maybe a little red mark or something like that. And the parents are just, completely up in arms and like, oh my gosh, my dog is going to kill somebody someday. When it's sometimes very explainable what's going on. The dog, maybe the child grabbed an arthritic dog by the scruff and was just trying to play with it and really being rough with the dog. And the dog finally had enough and was in pain and turned and nipped the child. But very normal, explainable, understandable behavior for a dog or a human to respond like that when they're in pain. So sometimes it's my job to help the clients understand what's really happening there. And that's actually not a very severe injury in the world of injuries for children or dog bites in general. Children are going to get injured more frequently, slipping at the playground or falling off their bike and have much more severe injuries. But the parents are never like, oh my gosh, that darn bike, we've got to put it down, we've got to throw it out, or because the child fell off the bike, right? But sometimes that's the reaction to a dog biting. Then on the other end of the scale, as you were mentioning, there's dogs that bite, and I've literally put people in the hospital, and sometimes the clients are really protecting their dog, which is understandable.
And they play it down, don't they? Yeah, my arm's missing, but it's okay. Yes.
Yeah, the guy lost his arm, but it's just a little scratch. You'll be fine. And you have to explain to them there's some severities and ramifications and consequences for that kind of situation. So a good trainer or consultant will help go in and help a client navigate, what potential outcome, and to look at the case objectively, keeping in mind, an empathetic response and also understanding what that client's going through.
Yeah, definitely. That's really helpful. Okay. I've got my list, guys. I'm not just distracted by my phone. I have an agenda again. Can you say, so we've said that fear of labeling dogs. Do you ever say a dog is generally aggressive?
Yeah, so I don't want to throw out the baby with the bathwater, as they say. It also depends on who you're talking to and which lens you're looking through in terms of sciences. So with the veterinary profession, they're often learning or talking through the medical model. And so the medical model actually does use a lot of labels like pain related aggression, maternal aggression, territorial aggression, resource guarding. They're going to use these labels, and as long as the professional you're talking to has somewhat of an agreement and there's that somewhat universal language, that's fine. So I don't want to say I never use those terms. And even with some clients that have a background or understand behavior, I'm not going to just I'm not going to necessarily not label it, because as long as we have the same vocabulary, when we start going cross sciences or cross professions, so like ethologists, for instance, will use the term dominance, but they understand the scientific term for that. But sometimes you put that over into the training world and people are like, oh, that's the D word. How dare you say that here? And so there's a lot of confusion in the terminology. That's why I try to keep the language very simple, unless I'm, again, talking to a colleague and someone that understands that particular language. So
yeah, because the last live we did, I did a little bit of research beforehand, thinking, right, I just need to be a little bit in zone. And I read an article where there was all these labels of different kinds of aggression. And I can remember reading them to you, and you're like, Yeah, it's kind of trying to put everything into boxes, and it's not that easy. And we do have a tendency to do that, don't we?
It is, and the problem that can happen is that, let's say we think a dog is resource guarding or is a resource guarding, so they're on the, let's say that we think they resource guard couches and beds and resting spots, right? So they go up on the couch, we try to pull them off because we don't want them on the couch, or we try to go sit next to them and they growl at us, or sometimes they're on our lap and we don't want them there, or we're just trying to get up and we try to move them and they growl at us. We think the dog is resource guarding that particular location. That could be the case, but it also could be because they're in pain. And so if we start to label that dog as a resource guarder, that's what everybody's brain is going to go to first.
Yes.
Tunnel vision on resource guarding, and then they forget, oh, there could be a pain issue or something else entirely going on. So it's important to really be careful when we use those labels, not to just say, okay, that's it. That's what the dog is doing. That's what the dog is. So always, but to answer your earlier question too, there are dogs, you could label as, I wouldn't necessarily, again, use the blanket term aggression or aggressive dog, but we can class certain dogs as dangerous or potentially risky cases. So I think that's important language to use rather than, that dog's aggressive. Well, what does that mean? How aggressive, right? But dangerous has a different connotation.
I'm going to take note of that, because you're thinking more about the people surrounding and what risk they're at rather than labeling the dog again.
Exactly. And you look at other factors too, the level of biting that the dog is doing and the previous incidents and the number of triggers and all those other factors. But it's important to assess not just, one moment in time. Look at all of the factors and the history in that dog's case, and then I'll give you an answer about what you're looking at without having to give it a label again.
No, and that actually is so similar to arthritis, in that I see it a lot where people get a diagnosis of arthritis and then everything that dog ever does is linked to the arthritis, and the blinkers go on and they don't think that comorbidities can happen. Oh, he's slowing down because of the arthritis. Well, no, actually it could have had something else going. It could be internal, could be something else. And I think we wish that we would only ever get one condition, but unfortunately that doesn't happen. So yes, guys, none of this, more of this. Okay, that's blinkers, by the way. Okay, something that kind of gets me is there's this ladder of aggression that lots of people talk about, and it seems very prescriptive and it seems almost too perfect. Tell us about it, so people that don't know about the ladder of aggression, and what's your thoughts and how can we use it? Because lots of this stuff is very useful, it's just don't read it black and white.
Yeah, it's Kendall Shepard, if I'm not mistaken, is the one that developed that, and it has a picture of a ladder and a dog, kind of, if I'm not mistaken, looks like it's walking up the ladder, but it goes through the various progression of potential towards aggressive behavior. So maybe lip licking, yawning, freezing, whale eye, the typical signals that come before biting in most cases, and all the way up to biting, right? So you get snarling, snapping, growling, lunging, biting. Don't quote me on the particular order, but you can readily find that online. You can see the different steps. I think it's a very useful tool for helping people understand that there are signals that come before the aggressive response. So dogs almost never go from doing nothing to biting. There's always signals in between. There are cases, yes, there are some dogs that go from nothing to biting, and a lot of those dogs have been punished for growling or doing other things that would typically try to make somebody go away before having to bite the person. But you often get these other steps. So you see the dog yawning, lip licking, and then all the way and up. The issue that I find I've seen happen, especially newer trainers kind of using that ladder, is that it kind of makes it, as you were saying, prescriptive. So, okay, every dog's going to yawn, every dog's going to lip lick, every dog's going to go through this ladder. But a lot of dogs are going to skip rungs. They're going to jump from here to here, or maybe go from here to here, go back down the ladder and then back up. So it's just to keep that part in mind, that it's not necessarily every dog's going to go through every step. And
that there's like a little gobstopper. So we've got aggression, we've got all of these behaviors that it's like a dandelion. dandelion head, like, you know, the
Mm-hmm.
explosive behavior in the middle, but actually there's so many different things and it's not in an order.
Mm-hmm.
You just can find.
Exactly. There's a lot of precursors for a true aggressive response where it's biting, growling, snarling. There's a lot of other precursors that come much earlier before those things. And the more you observe dogs, the more you're going to be able to see those micro signals, I call them. And
Well,
then
you heard it here,
really,
guys. It's now the dandelion of aggression, and we came up with it.
a new graphic we have to come up with. Yeah, and you'll start to see even more subtle signs. Like, as I'm sure you can see the most subtle signs of a dog suffering from arthritis. You're going to see that probably before most professionals even. Same thing can happen if you see enough dogs that are going to go to aggression. You start to see these most subtle things like a breath hold or a nostril twitch or a flare or something like that, and you're going to see, oh, that dog's starting to climb that ladder.
Yes.
So we have to be careful. So, yeah.
I'm glad that you said that, because a lot of people that get into the world that I'm interested in go through a very, very awful situation where they start seeing ghosts, where you go into the outside world and you just see dogs in pain all the time. And you'll walk in the park and it's there. You'll have a chat with a family member, their dog's in pain because of what they're describing. And you go through a very low period where you feel consumed with guilt. You feel like you're struggling to help all these animals because no one's listening.
Mm-hmm.
So yes, I totally get that.
The same thing happens to dog trainers, right? So they start to see the subtle signals. They start seeing people interacting with dogs, and the dog really doesn't want anything to do with that person. And then when you start to pick up on the micro signals, it's even more obvious. And then especially you as the trainer going in and meeting dogs, people think that, oh, he's the person that likes dogs, or he works with dogs, or she's great with dogs, she's a trainer. And you go in and work, you know, and a lot of the times at you seeing these dogs, the dog's saying, nah, you're okay, but I don't want to interact with you. And people expect you to interact with their dogs, especially if the dog's not barking, lunging, or growling at you, but they're giving you those micro signals that say, yeah, okay, you're cool, but I'm okay over here. I'll be over here and you stay over there and everything will be good. And so you ignore the dog because you're reading that. The dog's speaking loud and clear that they want nothing to do with you, or maybe they need a moment. So I don't get into the dog space, of course. I don't go over there and try to pet them or interact with them until they say, hey, I'm over here. Can I say hi? Or they come up to you and they engage with you. That's the only time I interact with the dog. So it is kind of, you know, it was tough for me to make that transition, because when you first start out, you're just getting in and working with all dogs or touching all the dogs because you want the clients to feel good about it. But then I realized that if I do that, I'm risking getting bitten in the cases I'm working. And the dogs don't, you know, we have to think about the dogs.
Think about the dog. Yeah. So how do you manage it? Because when I started feeling that I needed to let the dog tell me what the problem was, so I'd go into people's houses and I'd do my home assessment. I'd be talking to the owners and they'd be like, do you want to get on with the job? You know, you're here for an hour and a half and you've been here half an hour already. You haven't even touched the dog. And so the way that I managed that is I sent a information pack out before any visit, and they were fully aware that I took my time. And these are the reasons why, because I wanted to see the behavior, the posture, the movement. And how do you manage that? Because as you say, you are a business and you've got to provide a service, and meeting the owner expectations is part of that. How do you do it?
I think it's easier for me than for you, probably because I have more luxury of time. You know, veterinarians can't sit there for an hour or 2 hours with a client. Each client, you have to see multiple patients in a day to pay the bills, right? And so it's a little different. You said the key word there, Hannah, which is time. Time is so important. And as trainers, we feel like there's a time crunch, but there's often that time. And this is not on a macro level, right? We're thinking of like, how much improvement can we make in this dog's life in 3 months or in 8 sessions or whatever. But we have to remember there's that time during that session. So that 1 hour session, there's that time. Use it wisely, but also think of the dog, because sometimes just giving that dog a few extra minutes to settle in and to realize you're there and to check you out and feel safe without any pressure of training or equipment or anything, not even talking to the dog. Just let the dog feel comfortable in its space with you there. That can go such a long way versus, and even if it's just like 3 or 4 minutes of that versus in the first minute, I'm trying to put a leash on the dog or something. That just little adjustment there can go such a long way with so many dogs, especially the dogs that are nervous or fearful or have a negative association about a particular situation. Give them time, and you're often going to get there much faster, right? It's like the turtle and the hare, right? It's going to be much better if you go slower, slow and steady. So,
yeah, and I think therapists have this as well. So a lot of owners say they want to start hydrotherapy or physiotherapy, and they go all excited to that first consultation, and they may be parting with anywhere between 35 and 55 pounds, we don't know, and they've got 45 minutes to an hour, and they're like, he's not done anything. I'm really sorry, but I'm really unhappy. You haven't done anything. And the physiotherapist or the hydrotherapist saying, this first opportunity to give your dog confidence in this strange environment is money well spent. Okay, so I didn't massage, I didn't get them in the tank and striding out. So that, again, I know most therapists will preempt that disappointment by saying to the owner, this first session is crucial for giving your dog's confidence, so don't expect me to do great things.
Set the expectations in the beginning, and you're going to prevent a lot of hard feelings from happening. That's for the professionals out there working in either facet, right?
Yeah, definitely. Cool. Okay. So now, and the reason you're here, what are the major causes of aggressive behaviours? And I've even been cheeky enough to say, in your opinion, can you pie chart your experiences? So how many have had medical reasons, how many have been previous training experiences, etc.? What kind of percentages?
Yeah, so if we're going to break it down to pie chart, I would have a pie chart of underlying motivations, because there's a motivation for aggressive behavior. It's different than the motivations a dog might do for other behaviors that we as trainers might get hired for, like a dog pulling on a leash or jumping up on the guests or the counter. Those are often reinforced with a positive reinforcer. But for dogs that are using aggression, their goal is to make something go away. So it's a negative reinforcer in the technical terminology. So it's a little different in the motivation, because often the underlying motivation is what's fueling the behavior. If you get rid of or you fix the underlying motivation, you fix the behavior. So it's for instance, it's the whole reason that one of the fallacies is if you comfort your dog when they're fearful, or they're having a hard time with a thunderstorm, or somebody's coming to the door, and you're like, it's okay, don't worry. And one of the most common fallacies is that you're going to reinforce that fear or that behavior. So let's say your dog is barking at the thunderstorms or barks at the person that comes to the door, and we're saying, don't worry, it's going to be fine. For a dog that's fearful of those stimuli, we're only going to make things better for them. People always think, oh, it's going to make it worse, we're going to reinforce that behavior. You cannot reinforce an emotional response. That's the big differentiator. So with aggression, there's often an underlying emotional response. And if we're going to look at that pie chart, the most common one is fear. By far, the dog is just fearful of that particular stimulus. They want it to go away because it's scary. They feel threatened by it, so they want it to go away. That's probably the most common thing I see. So the dog is afraid of the scary man coming in the house with a hat on, or another dog barking and lunging at it across the street. And those are all fear-based responses. If I had to put a number 2, it's probably dogs that are just protecting stuff that is valuable to them, so the resources in their life, and that can be the typical food or toys or bones. It could also be resting spots. It could be people. It could be territory. So a dog just protecting something that it values. And that's very normal behavior. For dogs, for humans, for dolphins, for anything that survived through the millennia, it's been what we did to survive. Look at the toilet paper and the hand sanitizer a year ago. There was resource guarding by humans, right? And people were fighting over that. Same thing for dogs. So it's very, very normal for a dog to growl near a food bowl. And if somebody goes near it, obviously how we respond is going to make a difference in what can happen in the future. But it's very important that we recognize that's not normal. So fear, resources. I would say the next one up is negative associations created through the dog's life events, whether it's something that was frightened the dog before, or a training method or tool that the dog has experienced and formed a negative association. Here in the United States, a common one I see is the invisible fences or the electric fences. I don't think they have those in the UK, or maybe they're banned.
Not that much over
Yeah.
here.
But it's a good example I can use is where the dog experiences a negative stimulus. So they run to the fence line to go say hi to the mailman or the mail carrier, and they get the beep or the shock from the fence, and the fence that keeps the dog inside the yard. But over time, every time that mail carrier goes by, and the dog's just excited because it's mail carrier coming by, and the stimulus of the beep also, once conditioned, has the same properties as the shock in terms of what's happening inside the dog's brain. It can become a negative association. Over a few days, the dog's like, this mail carrier person, I don't know. Every time they show up, something bad's about to happen.
Yeah.
So that's a negative association. Collar corrections too, any kind of yanking or jerking on a collar when the dog's got an aversive collar on. And if you do that enough times, every time the dog sees a particular stimulus, they're going to be like, that thing is going to predict a collar correction. So you get negative associations established. So that's the third one. If I had to put a fourth one in the pie charts, it's lack of socialization. So dogs, especially during the pandemic, we're seeing a lot of this. A lot of my colleagues and students are getting very, very busy with dogs either suffering from separation anxiety or lack of socialization related aggression issues. So the dog has been contained in the house for a year, and they finally get out and see their first person on a bike or their first, scary man in a hat, and they respond aggressively because it's just like if a big green alien showed up right on our front lawn. We'd at first be like, what is that? And we could respond aggressively, especially if the green alien started walking to our house. And so very normal response. But if we've been seeing green aliens our whole life, it wouldn't be a big deal. Right. So you have to think about for our dogs that. So that's number four. And fifth, I would say, to round out the pie chart, is genetics. Genetics can play a role in behavior. It's the whole nature and nurture argument, but it's both nature and nurture when it comes to behavior. And sometimes genetics play a role. Sometimes it's the parents of the litter or other generations of the litter have a propensity for aggression, or we've asked them to be aggressive for work. So certain breeds, livestock guardian dogs, for instance, we've asked them to display aggressive behavior when somebody approaches the property. So it's quite normal to see that happen in future generations. So those are probably top five. There's of course other reasons, but I would, and then of course the whole reason we're here is the pain issue. But then I kind of dip into the negative association and fear issue when I'm looking at the pain. Pain is a physiological part of it, but then what's happening in the brain is the dog has negative associations to people touching their leg or whatever because previously it hurt, and then they're also become fearful of that particular stimulus. Ooh, that could hurt. All right, so the dog is from somebody reaching. So it's a category on its own, but it does what's happening from a motivational response is that it's often fear and negative association related. So
I love this. I feel that I've got a pie chart in my head now, and I feel that I can go around the clock, and I've got my segments, and I know where pain is fitting in. I love that. I need to just recap a little bit. You were talking about in the past, people have said that you would reinforce a fear-based behaviour. Oh my God, I went back in time. Holly had terrible noise phobia when she was younger, and that obviously was related to pain. So it came on when she was about 4 years old, and she had cervical disc disease, lumpectomy disease, blah, 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 blah. Anyway, I was living in Germany at that point, and I ended up seeing a number of different trainers, didn't understand qualifications and all the systems and organizations. So you went on advice of word of mouth. And somebody came in and they were like, yeah, when she's like that, you just need to leave her alone. Don't comfort her. Don't be there. Oh my God. And you take that advice and you just sit there feeling absolutely crippled that your dog's shaking, dribbling, terrified, and you're being told, no, you're not allowed to go and be comforting to them. Oh, but thankfully, within a few months, I met somebody else that went, no. At this moment in time, your dog needs the comfort of your presence, but there is misleading advice out there, isn't there?
Especially on that one. There's still quite a bit of advice online and other places that say don't comfort a fearful dog, but it's just unfortunately a travesty. I mean, if you think about it, if we just equate that to children, so if you look at the developmental capacity of a dog, they say it's about the equivalent of a 2 or 3 year old child. And if we were to say, if a child was in the corner shivering because of something scary, we wouldn't say, oh, just leave them alone, they'll be fine. Let's go watch TV in the other room, just leave them, because we don't want to reinforce that fear. Yeah. Can you imagine? Just think about that for a moment. And so it's, yeah. And do you think that comforting the child's going to make it worse, or the child's like, oh, I'll be more shivering and more fearful next time somebody comforts me? So comfort, and if you think about anything that you're afraid of personally, like when I tell clients this, think about something you're afraid of personally: spiders, snakes, falling out of planes, whatever it is. And if I'm at that moment in that time comforting you, saying, it's going to be fine, giving you your favorite food, whatever is going to make you feel better, is it going to make that fear worse? It's not going to make the fear worse. It's impossible to make you freeze more, shiver more by comforting you.
Yeah.
Right.
Yeah.
Think about though the other part too. Is like, just real quick, because sometimes people get advice. You need to the dog is not being submissive enough, or you're not being alpha enough, and so the next thing you know, they're pinning or doing something aversive. We punish that behavior because you don't want them to learn that fear is okay. And I've heard that advice too, which is awful. Think about like punishing a dog that's already in that state. And the advice is, you got to alpha roll, or pin the dog down so they know you're the boss, so that they feel like you're the leader, and then the leader's going to take control of the situation. It's just wild, the advice that goes out there. So,
God, Luna, who is Holly's apprentice, that would just break her. That would just absolutely decimate her. But another thing that I got very mixed advice about, just with the noise phobia, because somebody did say is noise phobia related to pain, and there is definitely a strong link with dogs that develop a noise phobia when they're in their middle age and older. And there's a brilliant paper by Professor Daniel Mills Group from the University of Lincoln all about noise sensitivity and pain. Mm-hmm. I got very mixed advice about this, is that I could sometimes distract Holly out of it. She had an obsession with water. So if she was having a noise sensitive moment and she was displaying fearful behaviors, if I went and turned the shower on, sometimes I could bring her out of it and she wouldn't go back into it. But some people told me I wasn't allowed to do that, whereas other people said that I was. What's the current thinking on that one?
You can absolutely do that, because you're using an activity that's going to keep them focused on something else. Same, go back to the child analogy. If we say, let's go play your favorite game, let's go play Legos, or let's build something together, and that takes their mind out of thinking about the thunderstorms or whatever's scary in their environment, is it going to make things worse? Again, because there's some behaviors, yes, that you got to be careful of. So if the dog is jumping up on the counter to grab your sandwich because you left it there, they're not fearful of the sandwich. There's no fear response going on. So the underlying motivation is different. And then if I said, okay, let's come over here and play with your food over here, sure enough, I'm going to reinforce that behavior of jumping up on the counter. And dogs like, oh, if I jump on the counter, then they're going to give me this other food over here. That's where some of the confusion comes in from. But if the underlying motivation is truly fear, you won't make it worse. You're only going to make it better, because you're giving the dog something else to do to help them take their mind off of that scary event. So fear-based behaviors are different than behaviors the dog's having a good time with, or there's a different motivation for it.
Love it. Good distinction there. Nice, clear distinction. So spread those words, guys, because we really don't want our best mates being made to feel worse. And there's a really good question here. I'm just going to let you have a gander at this. Sure. Could underlying pain also have an indirect effect in the decision-making process? E.g., a bad tooth would make me grumpy regardless of whether someone was near my face. What's your thoughts on that?
So, and I'm assuming they're talking about the dog's decision-making process. Yes. Is that correct? So absolutely. Think about, they say not to anthropomorphize much, which is attributing human traits to dogs. But I think we can actually do that much more now that we're understanding there's much more science out there about underlying emotional responses in dogs and these cool things, fMRIs happening, and we can actually see what's happening from a neurochemical response. So there's actually a lot of similarities now that we can apply to dogs and in humans. So I always say for this particular issue, pain is very universal between dogs and humans, what happens in their brain. Mm-hmm. And so if you're looking at a pain response to a dog, think about it yourself as a human. If I just had a bad toothache and I'm grumpy, and somebody, my girlfriend comes over and asks me to like do the dishes or something, I might be more likely to have an aggressive response or grumpy response than if I was in no pain and just having a good old time, right? So it absolutely can affect. I don't know if I would call it the decision-making. Well, actually, yes. So, in terms of what choices the dogs makes and what behaviors you might see, yes, you're going to see an impact on that. Dogs that are in pain are going to make different choices, different behaviors are going to come out, and severe pain can certainly impact the cognitive processes, we'll call it that, in terms of what they're going to do. It can affect their decision-making processes. Maybe previously they wouldn't have been somebody, especially if you stack different stressors on top of each other. Let's say the dog does guard its food and it's got a toothache, and then you go near the food bowl. So you've got double of what would stress the dog. And versus if the dog's tooth was fine and the dog was just eating, there's a higher likelihood of an aggressive response because the dog's not feeling well from a toothache and they're guarding their food bowl. So consider that.
Are you allowed to use the terminology tolerance? So the reason I say that is I was just thinking one of the things that started CAM was I developed something called supraspinatus tendinopathy. And it's basically an inflamed tendon going through a very small gap in your shoulder. So every time you move your shoulder, it could be like a stabbing knife, but there was always that undercurrent of a throb there. And it went on for months, and I'd be at work and my tolerance to people, to colleagues, to movement, to typing just diminished. I just didn't have the same patience. Are we allowed to use terminology like that?
I think so, yeah. I mean, it's not a commonly used term, but I think it would be understandable if I was to speak to another colleague about using the word tolerance when it came to behavior. I think more the accurate terms would be we use threshold, so the dog's threshold for biting or showing aggressive behavior. And that picture like a line in space. And anything above this is growling, snarling, snapping, biting. And anything below that is like you're sleeping and then like getting towards that threshold. And that's going to float depending on the stressor. So if the dog's not feeling well, is in pain, we're pushing that threshold line down. But if we address the pain and we work on the behavior, make sure the dog's not feeling stressed, we push that threshold line up. So we can throw the stimuli at this like dartboard and we're more likely to hit this space. Yes. But if we're not careful, we could hit this space above that threshold. So our goal as pet parents and professionals is to push that line up. And that's the threshold. So that's one. And then, the other big one is resiliency too. So everybody's, humans and dogs, have what's called a resiliency. It's their ability to cope with stress and then come back to a level of homeostasis. So some dogs and people can experience stressful events and only need a minute or two to just be like, okay, I'm fine, I'm okay again. But some dogs and people, they have a tough time coming back because their cortisol spiked. They're very stressed out and tense about whatever just happened. And that can impact things, especially if it's pain related too, because it can take them time to come back to their homeostasis, if at all, when they're in pain. So those are the variables I kind of measure when I'm working with dogs, making sure you keep an eye on it.
I hope that all the vets and vet nurses that are listening are going, oh, these are good take-homes that I can take into practice. Good terminology. Okay, because we are talking about pain and behaviour, with your caseload, like maybe even let's do a flash in time. Let's do now, your current caseload. How many would you say, what percentage have a pain component to them?
That is a great question. One I would have to really guesstimate on. A third, maybe. Have some underlying medical component. It's not always necessarily pain related. It can be some other, it's not to say that pain doesn't come along for the ride in many of these ailments, but endocrine issues, things like that, vision issues, hearing issues, skin issues, all of those things that can also irritate the dog. But yes, it's really, really important to rule out underlying medical causes, especially for the cases where a dog is being touched or pet or handled, or any kind of husbandry or movement of the dog, physical movement. And that can include putting on a harness, putting on a collar, clipping a leash on, getting the dog off your lap, asking the dog to get off of furniture or into a car, or any kind of thing where you're asking the dog to do something that requires physical movement or being touched physically, and you're seeing an aggressive response. Almost 100% of the time, I'm saying, go to the vet first. Let's get these things. Let's make sure we're ruling that out. And it's also important to select the tests, making sure that the vet knows which tests to perform for that particular for the the behaviors described, I should say, because as you know, Hannah, there's a lot of different diagnostics that we want to do to rule out underlying pain or potential issues. So it's good to find those professionals, and just like trainers have stress specialists in their fields, veterinarians do as well. So I always say to find somebody that knows how to diagnose for pain and behavior-related issues. So
yeah. And it's tough, guys. And I think my definite input here is you rarely find a bad vet. I really, really sincerely mean this. You know, most vets that are out there really care about animals, but they have different skill bases and different timescales and availabilities, etc. And some of these cases might take a couple of visits. You might see one vet and you might not gel with them. Don't give up. You know, see another one. As you say, start going maybe down the specialist road, because vets are in a bit of a limited situation. Small room, slippery floor, table in the middle, 10 minutes, a lot of stress. One thing to add to that is we've got a little document called the Suspicion of Chronic Pain PDF. And when you're going to your vet, having seen a lovely trainer like Michael or a behaviour, give that vet enough information to direct them to there being an underlying medical cause to investigate. Go open with the intention of maybe a blood sample, a urine sample. Go open with the potential that they might suggest a non-steroidal anti-inflammatory trial for maybe 4 weeks, even potentially longer. Be open to this. But what I tend to see happen is a miscommunication. The owner goes in and thinks that the vet's got a crystal ball and has been through all of the consultations with the trainer that they have. The vet hasn't. And then the vet's going, right, the dog's behaving totally normal. I don't really know what this owner wants me to do. You need to take good quality information. So there's a Suspicion of Chronic Pain PDF, and it's divided into behaviour change, posture change, physical changes, capability and gait changes. You can put your findings. So that vet's going, okay, I see where we're heading with this. This could be pain related. She's on board. I know that they're going to accept an investigatory journey. A lot of vets try and read your facial expressions. And if you come in and you're in a rush and the dog's behaving normally and they're like, do they really want me to do a workup? I'm not sure they're really on that journey with me. Okay. So all I'm trying to say is it's not a perfect situation. Go with info. Whereas in my experience for the last 20 years, quite often an owner will come and say, I need to see my trainer, and they think there's something wrong with the dog. I'm like, cool. Where do I start?
Yeah. There's a lot of testing that would go with, I think something's wrong with my dog.
So yeah, just bear that in mind, guys.
Yeah.
Okay. Another thing about aggression, how does it start? Is that a ridiculous question? And progression rates, etc. So is there any way that you could categorize that? Do some dogs go from very first signs to quite profound aggressive behaviors pretty damn quickly and genetically learned, etc., etc.? Is there a time scale at all?
It depends on the dog, really. It's a study of one, as Dr. Susan Friedman would say. It's really the individual, and because aggressive behavior, again, I can't reiterate enough, it's normal behavior. It's something evolutionarily we've used to survive in many circumstances. And for dogs, it's no different. Every dog has the potential for an aggressive response if pushed far enough. So it's ingrained. It's in our repertoire. That button's back there to push if we need to, for both humans and dogs. But a lot of dogs and humans have a high threshold for any kind of aggressive response. It would take a lot to get them to go, But even the people that you would never expect, if somebody's threatening them or their family member enough, or for whatever reason, that person might reach for an aggressive response, whether it's pushing somebody away or punching them or pulling out a knife or a gun if they need to. And that's the differing levels. The same can happen with dogs. They might give you a hard stare, they might growl, they might bark, they might lunge, they might bite, depending on, again, their experiences. So to answer your question about escalation, it, again, depends. There's a lot of factors on that. It depends on the intensity of the stimulus, and if it continues to come and the dog's not getting their point across by growling, and the person's still not moving away, sure, they can escalate. The age of the dog also matters. So younger dogs, you typically don't see the same aggressive responses until they get towards social maturity, which is 2 to 2.5, 3 years of old, and even older with some dogs. But once you start getting into that social maturity range, you're more likely to see aggressive responses at a higher degree. But each dog is different. Again, And then breed, of course, and genetics can play a role in how much you can see something escalate. You take a couple Malinois puppies out of a litter at 8 weeks or even younger, they're already grabbing and latching onto something that's dangling in front of them because genetically that's what they're supposed to do. They're like mini little velociraptors, but the other dogs, you couldn't get them to hold on to something no matter how hard you try. You may get like a Cavalier King Charles Spaniel, they're probably not going to latch onto something. Well, there's exceptions to the rule, but that's again. So it really depends on the dog to answer that question. Yeah.
Okay.
Yeah.
And then the other one that you hear a lot is people saying, well, they've got what they wanted with that aggressive behavior. It's now learned, you're stuffed. Yeah, what do you think about that? Because I've heard people say that a lot.
There's truth to that. Yeah, it's highly reinforcing to use an aggressive behavior to make something scary go away. For any animal, again, it's about as strong of a reinforcer as you can get because safety trumps everything else. So you're going to want to be safe before you eat. So if you're falling out of an airplane, you're going to reach for the parachute before you grab your favorite meal, right? So it's safety trumps everything, and that's why it's so reinforcing for a dog to make something scary go away, because then they're going to feel safe again after the scary thing goes away. So they're going to remember that. Just like if I'm walking down a dark alley somewhere, and if I spun around and like put up a fighting posture towards somebody that I felt was a threat, and they go away, I'm going to remember that for the next time I feel threatened the same way. So dogs are no different. They're going to remember it, so it can easily get reinforced. Not to say you can't change it, though. So if I keep going down that dark alley and then I realize it's just, people that work there, they're taking out the garbage, and each time I keep turning around, and then I realize that I don't have to turn around and do this every single time. Now that's behavior modification. So I'm changing so maybe I'm like, okay, I don't have to do that. I'll just take a look. And the same thing for dogs. We could teach them, instead of putting up your fist or growling or snarling and snapping, you might just look, and then you can assess the threat and feel better about it, and then keep going on your way. So you don't get rid of aggression. You can modify your response to the triggers.
Perfect. I love that. And because I could talk to you for ages. We've already hit 55 minutes and there's a couple of questions and I feel totally frustrated because there was so much more to cover. So you're going to have to come back in another 5-6 months. But you've led really nicely into what is out there to help these situations. Let's get a case in here. So we've got a dog. It's a 2-year-old. It's a golden retriever. He is in his second home because his behaviour previously was unwanted by the previous owners. So he went to a shelter. He's come back out, and he has started, as you say, being difficult to handle around the house, turning around, baring teeth, bit grumble, even snapped. And it turns out he's got hip dysplasia. So he's had hip dysplasia throughout. He's now got arthritic changes, bilateral hips, he's got some muscle mass loss, he's got gait adaptations, some coat changes. And the owners are very with it. They've watched this show, they're on it, and they've been to see their vet. The vet was very great, because I've got a lovely comment here from Becky Lovell Newman. This is great in theory regarding vets, but what if your dog won't let any vet anywhere near them, and each visit increases the fear? So in this situation, the vet was really on board and said, hey, look, let's use footage. So let's use video footage, let's use static photos, let's look at your dog's posture, we'll have a good impression. And trust me on this one, I believe that there's a pain component. I think knowing this breed, age group, what I'm seeing, let's get the dog sedated, get these x-rays, and then I'm going to put you in the hands of somebody I really trust, which is a physiotherapist. And this owner's built up this wonderful relationship over time with this physio, and the dog is beginning to get comfortable with being handled. So that would be the gold dust kind of response, Becky. That's what I'd love. Dogs being put on a non-steroidal, they've modified the home environment, they're not over exercising the dog, all the multimodal CAM approach, but they've still got this underlying unwanted behavior where the dog jumps from 0 to a bit hero without taking the calm approach. What time scale and what would they need to be doing to bring that dog back into an acceptable response that the family could live with?
Yeah. So those cases are not uncommon, actually, because what can happen is that even if you treat everything, the dog's feeling much better, there's still a potential for a negative association. The dog's like, okay, because they can't self-diagnose. They don't say, oh, I have arthritis or hip dysplasia or issues with my C1, C2. They're responding to pain. And if that association is created by somebody doing something, whether it's you get off the couch and the dog's like, ouch, and that was kind of bad. And well, maybe I shouldn't get off the couch when they say get off the couch or something. Or the person pet me there, they were touching, or they put this harness on me and it kind of hurt. Even if you get rid of all the pain and everything's great in the dog's world health-wise, the association can still be there. Like, oh, if a harness goes on, it could hurt.
Yeah.
And so you have to work on that aspect. And one of the concepts I use is called counter conditioning, where you change the dog's association to that particular event. So if I'm going to put a harness on you, I'm going to do it in gradual steps so you feel safe with me doing it. That's the most important part, making sure the dog feels safe. And I might just present the harness, and then I'm going to give you something you really like, whether it's your favorite treat or your favorite activity. Usually food works fastest. And then I'm going to present the harness again. Food happens. Take a second. Present the harness, get a little closer, food happens. And gradually each step, you're looking for the dog to be like, oh, this isn't so bad after all. Yeah. It's actually a little game we can look forward to. And at the same time, you're always looking for consent from the dog. You're looking for the dog to say, I'm ready to move forward to the next step. And you can do that a number of ways, reading their body language. You can ask for what's called a start button behavior, which is where the dog gives you some behavior like looking at you or looking at the food ball or whatever it is you're using. And that can be the dog saying, I'm okay with the next step, so let's go with this again. And that's important because it's got to be a conversation between you and the dog. You do not want to rush anything. And so getting back to Becky's question too, is that it's a lot of the time it's a gradual process in getting the dog to feel safe in that environment. So for clients that have issues with their dogs going to the vet, I recommend a couple things. Find one that understands the issue, of course. Fear-free vets is a great worldwide movement in terms of practitioners that are using techniques and tools that are very low stress and low restraint for the dogs. So I recommend them if you can find a practitioner in your area. But a good thing to do sometimes, just talk to the vet and make sure it's okay, but just go to the office, get out of the car, don't even go in sometimes, just hang out in the parking lot, fun games happen, treats happen, and then you leave. So no bad experience for the dog. Same thing if the dog's okay going in, go in, everybody's giving treats to the dog's having a good time, then you leave. So that's sort of the lower level cases. Some dogs though do need medical intervention, meaning they're so stressed about any kind of getting in the car even stresses them out and they're not taking any treats. Sometimes you need to talk to your vet about potential medication that can really help for those vet visits. There's a lot of different options for that. I won't give any specific recommendations since I'm not a vet, but there are options from a medication standpoint that can help your dog cope with that vet visit to get there, and then cope while during that visit, and then so it's gonna take sort of the edge off, so it's not as stressful for them. So there's a few different things you can do, but ideally, when you have the luxury of time, if you have the luxury of time, is to slowly get them used to those things. You can even practice these things at home, like teaching the dog when somebody lifts the skin of fold in the back of their neck for a potential injection, good things will happen. So you can just take like a ballpoint pen or like a pen that just click and then just kind of lift up the your dog's skin flap and just touch there. You're not obviously giving an injection or anything. And then after that, treat happens. And then you keep repeating that. So the dog starts to learn that every time that happens, something good happens for me. And over time, the dog's like, oh, okay, I know what they're doing. This is not such a weird thing when it'll go like this to my skin fold. And then it gets the dog used to those little things. So there's a lot of different avenues you can take to help dogs feel more comfortable.
Yeah, but Becky said another one, then we're going to answer some questions.
Sure, and I'm just going to respond to somebody that wants me to get into their meeting, but it's totally fine. I have time here. So yeah, okay. So I'll do that while you ask the question.
Yeah, this is lovely because she's already kind of said the dog's made such a strong association. Nothing seems to be working with building that safe relationship with that vet again. So she's now thinking medication and another vet. Another thing to consider is seeing if the vet that you're going to start attending has an external therapist like a physio, that they really work well together, because quite often a physio's environment is very, very different to a vet's, in that a physio is going to have a lot longer. They're going to have a different kind of environment, a more open space, a different kind of flooring, different activities are going to take part. They might be able to offer you a longer workup to getting that dog comfortable in that environment. So do just ask about that. And there was this question here. We're going to go backwards because I can see that you're running out of time. Not behaviour related, but arthritis related. Severe hip arthritis in an 11-year-old, very active dog. female. She's good on gabapentin, but how long is she going to be good on meds? We don't know. As she is 11, do you continue on conservative management or go for total hip replacement? She had a bad fall off the cliff, fractured femur, 3 surgeries to fix that, same leg, so a bit risky. Blah, blah, blah. Goes on and on. Okay, so we have got some videos about hip replacements. So first of all, go through the CAM resources. We've got videos by Nicholas Bartholomew talking about hip replacements. We have had Karen Perry Butler talking about hip replacements. It's the sort of thing that you can't really be given generic advice. You need to be speaking to your vet, getting second opinions. Hip surgery on the whole has a very good success rate. And age, as long as there's not serious comorbidities, shouldn't be a big game player. So if your dog is no longer responding to conservative management or beginning to break for it, then do speak to surgeons. I will admit there's a wide array of opinions. You've got some vet surgeons that are doing hip replacements and they say, get them done early, get the problem out of the way. Don't go through periods of potential suffering because you're thinking, I'll do conservative. Oh, it doesn't work anymore. Now let's do hip replacement. Whereas you have other vets out there that still feel very strongly that any surgery could go wrong. So do conservative and safe first before going into surgery. The surgical success rate with hip replacements in a practice that does them regularly is about 90 to 95%. So it's very, very successful surgery now. But it's got to be something you're happy with. So there isn't an easy answer to that one, I'm afraid. And every dog's unique. You might find that your dog does very well in medication, gabapentin, and anti-inflammatory conservative management for life. You might find that. Definitely get some hydrotherapy if you can. It does really, really help. There was a guy up here. I don't know, where are you? It was a great question. Here. Well, it was a statement question. Right. Do you think aggression is the right term if it is related to increasing space between dog and person? Aggression is defined as a behaviour motivated by causing harm. If they aren't wanting to bite, cause harm, could the term resource dog people aggression be poorly representing the majority of these dogs? Blah, 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 blah. Kind of what you were saying, isn't it?
It's a really good question. Yeah. It's the intent to do harm is an interesting one because you see that in a lot of the literature, especially the human literature, when it comes to defining aggression. And there's really no one agreed upon universal definition for aggression, I should say. Depending, again, on which science you look at it through, you're going to hear different, there's literally hundreds of different definitions in the literature. So, intent to do harm is also one of the arguable ones because we don't know what the dog is thinking. Are they intending to do harm, or are they just trying to make the threat go away without actually doing any harm? So it's a sticky one in that regard. So, but I do like what that comment was saying. Yes, about should we call it resource? I think it was resource motivated, aggression related behavior. We could, certainly, if that's an agreeable upon term between two people talking about it, absolutely. It's, I think at its simplest way is, again, aggressive behavior, or behaviours that we can just observably describe, because that's when everybody can agree. Everybody can usually see a dog that's barking and say that dog's barking. And that's what makes it a little easier for interpretation.
Definitely. And then because time's kicking on, I'm going to do this one as the last one. If there is a question over whether the dog's pain is completely under control or there is a flare-up, could training be counterproductive? Could you poison a cue if there is pain present during training? That's an amazing.
Ooh, that's a great question. So just so anybody that, so I can define, in case nobody knows or somebody doesn't know what it is poison cues is when you use a cue and then if it's followed up by something aversive or an unpleasant experience, such as if I said my dog's name, Fido, and then, did something aversive, like something threatened them or spotted them, or something that, I would never do or recommend, but it can happen. So then next thing you know, the dog's like, oh, I don't like when I hear my name because it predicts a punisher. And so the same thing can potentially happen if we are not careful, if we push the dog over threshold. Absolutely. So if I said, if I'm using clicker training, for instance, and then I'm like clicker and like touching the spot and the dog doesn't respond, I click and then feed, Theoretically, we're doing operant training there, but there's also the classical conditioning side where the dog's associative learning is happening. So, okay, I'm touching and then clicking and feeding. So our goal there as the trainer is like, okay, food happens after I touch that spot. But if I touch it and it's painful enough or over threshold, meaning the dog finds it an aversive experience, I run that risk of, okay, the dog's saying, okay, this is cool and all, but it still hurts. It's just like if I just broke my leg and somebody's like, okay, I'm going to do this cool little game with you. I'm going to come poke your leg and I'm stick my finger in your wound and I'm going to give you $1 after. Okay, let's do that again. And then here's $1 after. I'm going to be like, that was not cool at all. I don't care how much money you give me. That's not worth it for me. And next thing you know, the person could come over on me like, whoa, okay, get away from me because I know what you're about to do. And then if they continue poking, what's going to happen? Right. So same thing for dogs. And it's such a great question because it's an important factor to think about. Now, that being said, most of the time you're doing things, even if you do things somewhat sloppily, you still get away with it. Like it's difficult to really poison a cue for this particular type of work. It can happen if you're not careful and if you do it often enough to above threshold levels. But I find that it's actually kind of difficult to do unless you're really messing things up.
Yeah. Okay, so guys, I think because looking at the time, and I know Michael's busy and I don't ever want to burn him out and not get him back, I'm going to just quickly take the cheekiness to share something before we say our goodbyes and say thank you to Michael. Please, guys, this is the big walk, okay? This is massive. Mike knows about this because he's done us an expert soundbite for the big walks. 30 days, virtual walk. We are going to take you to different destinations every single day. We have got the Valley of the Kongs. We have got Doggingham and Barkingham. We have got Cowpat pasture. We've got Piddle Alley. And all these locations, there's pros and cons. So you learn about lifestyle change, exercise adaptation, modifications, etc. There's CAM Classroom in it. There's expert advice from these guys. There's Hannah's Hacks. There's competitions, discount codes. Oh my God. Every day for 30 days. There are 3 categories that you can enter. Garden Wanderer, £10, you get all the digital assets. Park Explorer, you get a t-shirt, bandana and all the digital assets. And then the Amazing Forest Adventurer, you get the CAM comprehensive course, all the downloadable booklets, a t-shirt, a bandana and all the digital assets for the month. All money from CAM, I promise you, goes back into CAM. There is no little middleman taking a little bite of the pie. This money keeps us going because we are completely independent. We do not have private funding. We are driven to help you, but you've now got to start helping us. So please, please, please support us with the big walks. Okay, back to you. I love you. You just make it simple. It's kind, it's simple, it's calm. Love it. Thank you.
My goal. I appreciate it.
So everybody, please say a massive thank you. It's supposed to be summer here, and we still had 85 people listening at any one point, which is really good for summer CAM listenings in, because most people are outside drinking by now. All the lockdown's gone. People are on the beers. So well done, guys, for tuning in, and we will see you next week. I believe we've got Jamie McClement. And we've got somebody else later in the week. I can't remember. My brain's gone. But thank you so much for listening. And Michael, thank you. And
my pleasure.
We'll see you later.
My pleasure. Okay. Take care, guys.
Bye-bye.